Hi friends, so today we will talk about how to choose your surgeon to perform your penile implants. Penile implant is, even though it looks like an easy surgery, it is a technically complicated surgery because in the implant it is not our purpose only to put the penile implant inside the patient's penis but also to give him girth, length, solve his premature ejaculation, give him or maintain his blood supply so he still gets erections after the implant, as well as give him excellent results, faster recovery, make it as painless as possible, and reduce the chances of complications. So, this can only happen if you choose a well qualified surgeon who has experience and who has done lots of implants. What happens is that mostly when patients are out looking for a surgeon for penile implants, they focus only on the price. So when you focus only on the price, you are actually compromising on the other three components. And what that can do is that even though you may get a cheaper implant, but you will always regret or always have problems that can occur later as you use your implant more and more. So what happens is that in the early phase of the penile implant surgery, where the implant is placed, the patient feels that he has undergone a good surgery, but it is only after 3 months or 4 months when he starts realizing that the implant is misshaped, misaligned, mispositioned, or the implant is not to his satisfaction. So today we will talk a bit about the qualities that you should look online when you're choosing an implant surgeon. First is qualification. Your implant surgeon should ideally be a urologist because the urologist is very intimately in knowledge of your penile anatomy, including the anatomy of your urethra, the anatomy of your bladder, the anatomy of your penis, and the tissues and the blood supply of the organ. When you choose a plastic surgeon for this implant, he is only focused on the skin tissue parts, but usually is rarely in knowledge about the other components of the penis. So first is qualification, so you should always look for a trained urologist to do your implant. Second is, does the specialist have any additional qualification to perform an implant in terms of fellowship trainings or in terms of center experience? Most urology training programs in India as well as abroad do not have penile implantation as a fixed curriculum component. So most big centers or high volume center urologists do additional training at other centers to gain experience and knowledge. For example, I have trained in centers across the world to enhance my knowledge about penile implants. So whenever you're choosing a surgeon, please also try to figure out whether he has received additional training for his penile implants. So a trained urologist with additional fellowship training is the minimum qualification that you should look when choosing somebody to perform your implant. Second comes experience. So experience is very important. Usually in centers abroad, it is mandatory for surgeons to at least perform 100 implants as an assistant with a primary surgeon before they are allowed to perform implants on patients independently. But India and other Southeast Asian countries where regulatory frameworks are weak, many times even beginners advertise themselves as qualified or as experienced implant surgeons. But what they're doing is that they are actually performing their learning curve on the first 100 to 200 patients. And there is two problems with that. First problem is that these surgeons never really know what is the correct technique. So they keep on doing the same wrong steps in their entire career and they never realize that how they could have corrected it. Because there is nobody senior or there is nobody more experienced to guide them to improve their technique. And the second problem is that the first 200 patients on whom they are doing these implants or learning these implants are acting as guinea pigs and end up with complications. Second, with experience, when you go to an experienced center, you know that the surgeon is familiar with all the different techniques of placing an implant. If in your particular circumstance, what technique will be beneficial, he is knowledgeable. He has a wide range of implants that he has used. For example, with me, I am board trained and certified to use Coloplast, Rigicon, AMS, and even the locally made or nationally made implants with a wide experience. He has the numbers. He has done at least 500 to 700 implants in the past 3 years. Ideally, a good center would have done that many numbers. So he has managed all kind of complications. Saying that I never had any complications should be a red flag. Should be the first reason why you should run away, because if there is a surgeon who is going to operate, he will always have had complications. Having complications is not a bad thing. Complications will happen if you are doing surgery, but reducing the complication incidence, and if complications happen, what to do. That is very important. So many times surgeons will operate and then they will refuse to see the patients, and the patients roam around not even able to manage their problems. So a good experience center assures you that you will get a good job done, and if any complication happens, there is somebody there who can manage your problem. The third are reviews. Always ask for patient reviews. Never believe directly what the surgeon or the implanting facility is promoting. What happens is that as a surgeon, I may promote anything which is in the textbook or in the theory, and as a layman, there is no way for you to figure out that whether that is the truth or not. Reviews helps. Video reviews, audio reviews, pictures, and reviews on social media, they really help in building your confidence and also prove that the surgeon who is implanting you has actually done what he is promoting. So if you follow this framework of analyzing the surgeon's qualification, looking at his experience, and also reading about his reviews, there is a very high probability that you will choose a center where you will get a good result. What happens is that we as patients, sometimes me also as a patient, we ignore all the red flags and go just for the price. So you may end up with a center which is 10% cheaper or 20% cheaper, but in case of complication or in case of problem, you will then have to spend 2 times or 3 times the money to revise. And as I always say, the first implant surgery is the best implant surgery, because what result I can give to you in the first surgery, we can never replicate that result in a revision or in a difficult case.